Hello, I'm Dr. Bresky, one of WellSpan's obstetrics and gynecology residents. In this video, I'm going to be talking about a type of vaginal tear that can occur at the time of delivery and what to know if you have had one of these tears. Tears that are specifically located between the vagina and anus are graded from 1st to 4th degree based on how deep they are. 1st and 2nd degree tears involve only the vaginal skin and vaginal muscles, whereas a 3rd degree tear is when the muscles of the anus have been torn, either partially or all the way through. Finally, a 4th degree tear is a full thickness tear through the muscles of the anus and into the lining or wall of the anus or rectum. Often patients with either a 3rd or 4th degree tear benefit from some additional care and consideration, and this is what I'll focus on for the remainder of the video. After a 3rd or 4th degree tear has happened and repaired, you may find that ice packs can help with pain, sensitivity, and swelling. You may need to continue pain medication for several days, and common choices include ibuprofen and acetaminophen. You may also consider sleeping on your side and find that sitting on a circular or donut-shaped cushion helps decrease the pressure on the healing tear. Finally, urination can be painful as the acidic nature of the urine can cause discomfort on the healing tissue. To prevent this, you can use a spray bottle to spray plain water on the area before you start urination. Bowel movements can also cause discomfort as the healing tissue is stretched. So, laxatives like the ones listed are recommended. You should strive for stool that is about the consistency of toothpaste while avoiding anything looser than that. If you are placed on antibiotics, please keep in mind that diarrhea or loose stool are very common side effects. So discuss this with your obstetric provider if this occurs and temporarily stop your laxative. Sometimes we'll even make the recommendation to take a half tablet of over-the-counter Imodium to stop the diarrhea if that should occur. After bowel movements and throughout the day, try to keep the affected area clean with sitz baths. In the shower, you can gently wash the area, and afterwards just be sure to pat dry and make sure the area stays dry. In terms of your activity, you should be avoiding any strenuous activity, any heavy lifting. Do not resume intercourse until your provider lets you know that it's safe to do so. And this should be no sooner than 4 to 6 weeks after delivery, and only if and when you feel ready. Note that all of your sutures will dissolve on their own and do not typically need to be taken out. You may notice that small pieces fall into the toilet or into your underwear, and this is normal. If you experience any of the following, be sure to call your obstetric provider. For example, if you have an unpleasant discharge or odor, if the area looks red or becomes swollen again, if you have a fever of 100.4 degrees Fahrenheit or higher, if you've had accidental leakage of stool, or if you suspect that there is a separation of the healing tear, these would all be reasons to call your obstetric provider. After leaving the hospital, you should have 2 follow-up appointments at your obstetric provider's office. One appointment should be at about 1 week from delivery, and again about 4 to 6 weeks after delivery. At those visits, your obstetric provider may refer you to a urogynecologist if they diagnose or suspect that there may be an infection, a large separation of the wound, or if you're having an unexpected amount of pain. Physical therapy can be helpful as well. If you have had a 4th degree tear or are having accidental bowel leakage, then you are more likely to be referred for physical therapy, and this is usually sometime between 8 and 10 weeks after delivery. You can expect pain to improve gradually. It is normal for it to sometimes take up to 3 months to fully resolve. Please also keep in mind that there is additional support for women who have been affected by the birth experience or the experience of a significant vaginal tear. Please talk with your healthcare professional about what is available.